And now the news. The mandatory National Health Insurance Program launched by government on September 1st, 2015 has gotten a good start since taking full effect on January 1st this year. Deputy Director at the Social Security Board, Roy Barry, who holds responsibility for NHI, says the NHI is working. Barry told JTV News this week that several residents have already benefited from the services offered through NHI. He said some residents utilize the air ambulance services to receive treatment overseas. Now, for a private healthcare perspective on NHI, we spoke with Dr. Hesketh Vanterpool of Eureka Medical and Bougainvillea Clinic.
The private medical practitioners in the BVI came together and late last year and formed an independent provider association. And so I happen to be the president of the IPA, but we have other members, lots of other members that are in the group. We have Miss Alice Pickering from Picksmith as the secretary, and we have Dr. Mitchell Penn from Penn Medical as the treasurer of the IPA. And we came together initially and had discussions as a group with the NHI before we actually signed the contract. So we also signed a very short-term contract for 3 months with NHI with the intention of having using this opportunity, that period of time, to see how the rollout goes and to have further discussions with them and maybe fine-tune the other aspects of the longer-term contract.
And you can safely say you've heard from other members of the IPA with respect to how NHI has...
Yes, at the end of the month, I polled the members of the IPA, and I got responses. Some gave it an 8 out of 10. Some said it was really not much problems. And when there had been issues, we could work together to sort them out. So plus I got my first check.
Yes.
I've got my first check on time. And so did other members of the IPA get their checks just before the end of last month.
22 local medical providers have already signed on to NHI, and the first payment for the year was made to local healthcare providers at the end of January for services provided under the NHI plan. Minister for Health and Social Development Ronnie Skelton presented a check to Richard Lake, the first individual to be compensated via the NHI system on February 1st. But have there been any challenges despite the reports of a good start for the NHI?
NHI is really an insurance company. It's an insurance company. It happens to be a government-run or a Social Security Board-run insurance company. So I immediately have to compare it with the number of private health insurance companies that I have dealt with over the last 25 years. I was indeed the guinea pig when Atlantic Southern came on board with a preferred provider group. And I was very much involved from that very early time. And I've been involved with every other insurance company that have come on board. Every insurance company, when they come into the market, they come with great promises, but very often it takes some time to iron out the kinks in actually providing the services. Very often there's a challenge while they establish outside provider network for referrals outside of the BVI. And so NHI has not been greatly different in that way. However, I think they have done a great job in finding places for us to refer patients when they do need to be referred off island so far.
That's under the JIPA network?
It's under the JIPA network, and perhaps other people have been involved as well. You know, so not everything, I don't believe, have gone through JIPA. Some go through other, but with JIPA's help very often, yes.
Meanwhile, the Deputy Director of the Social Security Board says one of the challenges during the rolling out of the health plan has been the limited space available at the NHI offices. According to the NHI website, 33,000 residents were registered by January 14, 2016. Responding to a question about the reason why people are still queuing up outside the NHI offices. Barry says apart from persons who are in line to have their photo taken or to collect their NHI cards, registration will always be an ongoing exercise, especially for persons who are just entering the territory for employment purposes.